dental dam can be done for any procedure that needs moisture control, right? But most of the time now, they only use it for root canal. But most dentists, like the older dentists back in the days, they use root canal, they use dental dam for all procedures, not just root canal. But nowadays, mostly just used for root canal. Okay, so before we go there, first we have different kinds of clamps. Each clamp also has different numbers. You don't have to memorize how it looks like to know the number, because the number of the clamp is already written on the clamp. So there's here, this is number 2 by looking at it. Okay, this is number 2, number 7, number 8, number 13, number 9. Okay, write it down. Number 8. So these are all the numbers that you just have to memorize. Number 8 or 8A or 8ABC. No, it's number 8. This is for molars only on the maxillary. Okay. Number 8, only molars on the maxillary. Number 7, only molars on the mandible. Number 13 or 13A, molars on quadrant 1 and 3. 13. 12, molars on quadrant 2 and 4. Number 2 is for all premolars, upper and lower. Okay, this is number 2. Only number 2 is premolars, upper and lower. And then we have the butterfly clamp, or we call it cervical clamp, or we call it 212, or we call it number 9, is for anteriors only, upper and lower. Good? Memorize all those numbers already? Good. So you make sure you remember. Later on, I'm gonna call you one by one and give you numbers. You tell me the tooth. What tooth or what teeth are those numbers for, okay? Now, when we do dental dam, usually we will give you the tooth number first on the procedure. Okay, so for example, I tell you, okay, we do 1/6, right? Our working tooth is 1/6. 1/6 is our working tooth. Okay, for what procedure? We have what we call, if I say, okay, only for restoration, then we have to isolate. There are 2 ways of isolating it. If restoration, okay, listen, if restoration, there's 2 ways of isolating it. What do you mean by isolating the tooth? What tooth we're gonna expose? Understand? Okay, let me see. Okay, if it's a restoration, you will isolate the tooth either multiple isolation or complete or max optimum isolation. What's the difference between the two? Multiple, if I say, okay, 1/6 restoration, we're gonna do MOD or MO for 1/6. So that means it's a restoration. So if it's a restoration, you will always isolate either through multiple or optimum. What does that mean? Meaning for multiple, you're only gonna expose 4 teeth. That means we're gonna cover the rest of the teeth. We're gonna expose only 4. That's what it means by multiple isolation. If I say, okay, do 1/6, your working tooth is 1/6, but let's do optimum isolation. Optimum isolation means 6 to 8 teeth you're gonna expose. Or, easily to remember, just past the midline. What does that mean? If my working tooth is 1/6, right? And I say, okay, this is a restoration procedure, right? Either amalgam or composite or glass ionomer, whatever the material you will use, but it's for restoration. If my working tooth is 1/6, I say optimum isolation. You're gonna expose 6 teeth. 1, 2, 3, 4, 5, 6 to 8. 8 is on the 1. But it's easy to remember past the midline. The more you isolate, the more stable the dental dam will be. 6 to 8 teeth or past the midline. So if the midline, of course, is 1-1, between 1-1 and 1-2, no, 1-1 and 2-1, you pass all the way to 1, and that will be your last tooth to expose. You understand? Are you sure? I don't understand.
What do you mean expose? It cover, leaving it?
Expose means you show
Okay.
the teeth, and then the rest of the teeth in the mouth are covered.
Okay.
Right? So isolation means you expose the rest of the teeth, or how many teeth, and then the rest of the teeth are covered. So that's for restoration. Now, If I say root canal procedure, so those are the different